Well, good morning. Still watching The Big Issue on City TV and also listening to us on 97.3 City FM. We've spent the first part of the show discussing the legacy of Jerry John Rawlings, and I did that with Professor Emeritus Jeffrey Haynes, Professor of Politics from the London Metropolitan University, Dr. Kwesi Jonah, political scientist, and Franklin Kujo is still with us as we move into the second part of the conversation where we pick up on COVID. And you can also send in your messages. WhatsApp line 0549 986 996, 0549 986 996, and 0550 585832, 0550 585832. Social media as well. You can hit us up on Twitter using the hashtag #TheBigIssue. At City973 is the handle. You can reach me on at East Sportsman, still using the hashtag #TheBigIssue. I will gladly read it. And don't forget, we're also streaming live on our Facebook pages, City TV Ghana and City TV 97.3 City FM. As well, also on Facebook. So do leave your comments there as we stream live, and I will share those comments in the course of the program. But let's talk about COVID now, which continues to raise concerns as hundreds more are being infected by this disease. It does look like the daily infection rate has gone up, even though we are still not able to do a day-by-day update of the daily infection rate. At the moment, there's like a 3 or 4 day gap in between, but hopefully we get to the point where we are able to give a day-by-day update of the infection rate. But what is clear is that at the moment, Ghana is hovering between 500 and 600 new cases daily, which is a significant cause for concern. We are told that the severe and critical cases have also gone up in Accra and in Kumasi, with children also being infected, as we picked up earlier in the week in Kumasi. So if we are to go by the report, we now know that 13 more people have died. The death toll is now at 390. Case count is at 3,940. And this after 625 new infections were recorded. So I'm going to play you back highlights of Thursday's Ministry of Information update with the Director General of the Ghana Health Service, Dr. Patrick Kuma Abuaje, speaking. Now, whilst the cases are also going up, the intensive care unit says of some of the hospitals are in dire need of supplies. So we went to the Ridge ICU as well to see what was happening there. So we'll hear Dr. Patrick Kuma Abuaje and then check out what's happening at the Ridge ICU, and then come in studio and speak to Dr. Justice Yankson, General Secretary of the Ghana Medical Association, Professor Alfred Yorson, Head of Community Health, University of Ghana Medical School, and Nana Kofi Kwache, Research Fellow, New York University School of Global Public Health, and Franklin Kujo, President of Imani Africa, is still with us.
The briefing emphasized on Ghana's case count and management, safety measures in schools, and the enforcement of the mandatory COVID-19 safety protocols. The Director General of the Ghana Health Service, in his update, stressed on the need to continuously adhere to the safety protocols, especially at workplaces.
In next step, let's continue intensifying the adherence to protocols. Let's promote decongestion in workplaces. We'll send another circular around that. Encourage virtual meetings where it's possible and work from home. And when we say it's about workplace, ensure that you have sanitizer at the right places. Ensure that even the vehicles that you use, people are able to sanitize. Get the janitorial people who are doing cleaners to ensure that certain surfaces are periodically cleaned. And of course, ensure the appropriate social distancing and adopt mechanism that allows less people to be congested, because it's a chronic mass gathering, just like we are doing here. So if you are not wearing masks and we are here, and there's a tendency to feel comfortable that my sister or my friend is okay, and so please, we need to really emphasize it, because that's the major place where we had a lot of the outbreak, or that one that we cannot do.
Staffing is a problem here. Imagine a 16-bed ICU we have only 3 critical care nurses.
Wow, 3.
And the rest are auxiliaries who are helping them. So ideally, there should be a critical care nurse at every shift because people are on ventilators, people are on oxygen, but we don't have that numbers.
The team lead at the center, Dr. Emmanuel Ahiable, outlines some of the challenges the center faces. He continues by calling for government's immediate attention.
The first 2 cases of COVID-19 in Ghana in March were brought here and they were kept at the 4 ward. But there was a time we thought, this being a regional hospital, we need to, scale up and build a bigger facility. And this place was built in October. And as a result, we are under pressure. So, like I said, we need more equipment. That's to upgrade this place so that we can give optimum treatment to our patients. Equipment such as monitors, patient monitors. We need oxygen. Oxygen is also very important here. We also need logistics for testing.
That was a conversation with the team lead of the COVID-19 ICU at the Rich Hospital, Dr. Emmanuel Ahiable. He outlined some of the challenges the center faces as he appealed to government to come to their aid. As of January 27, 616 new COVID-19 cases had been recorded, pushing the country's active case count to 3,813. The facility at the Rich Hospital still manages some of the critical cases. I asked Dr. Emmanuel Ahiable if things have improved since our January 18 conversation.
I wouldn't say things are getting better because we still have backlog of patients who have tested positive waiting to be brought to our COVID ICU, which has 16-bed capacity. So things are not getting better.
So in effect, things are getting worse. You told me on the 18th that you need medical supplies, you're running out of oxygen, the beds are getting full day in, day out.
Yes, I mentioned that the other time you came here. This hospital was not designed for infectious disease such as COVID-19, where they demand high volumes of oxygen. So because of that, the area we've designated at the COVID ICU, which has 16-bed capacity, plus the 8-bed capacity for holding, who are also severely ill, as awaiting the results, cannot cope with the oxygen, the number or the amount of oxygen we need.
My next question was this. If things continue this way and if government do not come to your attention, would there be dire consequences?
What you are saying there, if things don't improve in the next few weeks, I think the few staff who are working there, they'll be breaking down, they'll be reporting sick because of the stress and the overload of work. And also, it's going to affect the patients. The quality of care will not be the best for us. If things continue this way, we don't have enough doctors running the shifts at the hospital. We've requested for some medical doctors to augment the numbers here, but up to now we haven't heard from the authorities. So we are running 24/7 for now. So if things continue like this, like I said earlier, it's not going to work for the staff. Medical supplies are going to run out. The equipment we are using, like the monitors we are using, cardiac monitors, because we are using them often, they are breaking down and sometimes they don't function well. So we need accessories of these equipments. For now, the 16 beds have monitors for each one of them. They were donated by the Ghana Health Service.
The answer he gave to my final question made me shiver.
We are seeing high numbers of pregnant women who are testing positive. And as I speak now, 5 of them are on admission at our COVID ICU. One condition became critical this morning. She had tested negative as at yesterday. So she delivered by herself on Sunday. So she has been rushed to the main ICU for intubation and for further management.
Away from the Rich Hospital, I managed to ask.
So that is Dr. Ahiable's dire warning as our COVID cases continue to put pressure on our health service. And Dr. Justice Yankson, General Secretary of the Ghana Medical Association, is in studio. We've seen the statement, the 9-paragraph statements that you issued. Has there been any change at all, like in the situation since you issued that statement and today as you sit here? Has there been any improvement?
We need to look at various facets of it. In terms of the education, the masking up and what have you, very minimal improvement. These days you drive around and you see that, oh, at least there's a bit of improvement in the masking up. But you can still see that by and large, a lot of people still don't heed to the protocols. You see huge numbers, no physical distancing, you see gatherings still going on, pubs are still open and all that. So in terms of the preventive bit, we haven't really improved that much. In terms of case management, we are actually overwhelmed now because the cases keep piling up. And like we said, we are now seeing a lot more patients presenting with severe to critical illness. And our high dependency units, ICUs, are not enough. And then the personnel are also overstretched. I mean, just yesterday, I was frantically trying to see if we could move a patient to one of the treatment centers from a hospital. And unfortunately, the high dependency unit care that she needed, we couldn't really get it, and we lost her. So the death count is also rising. The daily infections, we've moved from the average 200 that the president gave us in his last brief to roughly 600 plus averagely a day.
And that's pretty high, even if you look at the global infection rates.
Exactly, and that does not augur well for us. So as things stands now, we are in very critical times. The situation is there, and we all need to look at what is happening. If you look at some statistics that Konfanochi put out recently, where about 544 people who went through the system and got tested, we had almost 50% of the samples returning positive results. So about 271 or so out of it. So if you have a sample, it's like a small research with a sample size, and then half of it return positive results. Clearly, this is not good. And that also mirrors the national curve. You can see that there's been a steep rise in the cases. So clearly, we are not out of the woods at all.
So it looks like we learned lessons from round one in terms of case management and whatnot. That would have given doctors or health personnel a bit more experience in how to handle this. But just the sheer wave of the numbers is what is proving difficult right now, and it's putting pressure on facilities and personnel. The government has come out with this free testing regime. Have you heard about it? Would that make a dent?
Well, it is supposed to help in the sense that hitherto our testing capacity generally was low. Access to testing was also more or less becoming one that has more of a commercial, connotation than a public health activity, because people had to pay. In some situations, we've heard about people being asked to pay 1,000 cedis, 500 cedis, 350, what have you. So clearly, the ordinary man like you and I, it may have been difficult for us to get tested, even where we think that clearly we may have been exposed or something. So if this free testing bit is really going to help us in terms of upping of the test regime, so that we can have a lot more people tested as and when they are exposed or as and when they are showing symptoms, then we can also be able to mop up or get to know the real numbers in the system. Because if you don't test, you might not know all the numbers. So this is something that clearly will help us. But the hope is that it is going to be one that we hope this will not be fraught with problems. Because hitherto we were all told that public testing in the public facilities was free. But clearly, not everybody could access that. So we hope that this time around, with what has been brought into the system and all that, it is going to help increase our testing capacity, because that is also crucial.
Now, one of the points that the Ghana Medical Association made was the suggestion to government: social gatherings, reduce them, enforce. How, it does not look like we are making any headway with that. Are you going to push any harder? Because one of the criticisms I've heard actually is that you guys at the Ghana Medical Association, you just issue the statement and then you give up.
No, but you see, the issue is very simple. We can only advise, we can only advocate. The worst case scenario is that we'll put our tools down. But that might not be the solution for this pandemic.
Yes.
Because we don't control the purse. We don't control the executive power. So when we ask governments, or when we advise governments, mind you, government also has its, in quotes, first line advisors, official government advisors. We do our best to interact with all of them. I speak with the minister, the DG, the president's advisors. Collectively as a group, we have meetings with them and what have you. But the ultimate sanctioning of a particular activity will have to come from the president. So in as much as we've made the case, the best we can do, like we are doing now, is to continue to advocate that these social gatherings be banned. If the powers be don't really act in that direction, we can't do much. And that is the reality. And I said the worst case scenario will be that we'll all say, okay, we'll put down our tools, we're also tired. But under this pandemic situation, that cannot be the way forward. So we are doing our best.
Okay. Nana Kofi Kwachi, good morning. Hello, Nana Kofi.
Hi, Godfred. Good morning.
Yes, thank you for joining us this morning. Nana Kofi Kwachi, Research Fellow, New York University School of Global Public Health. Now, Nana Kofi, you've been way back since December issuing warnings. Somebody says you are the prophet, nobody listened to that. This was going to happen. Why did we not listen, and what should we have done, and what should we do now?
Well, I think it's important that we always keep in mind the mechanics of how this virus spreads. There are things that we know that if we do, we can reduce the risk, and that if we don't do, the risk will be high. For example, we know that large gatherings, indoor, outdoor, are risky situations for the virus to spread. You can't see months of that and think that that's not going to be any consequences to that. You can't be having a situation where, thousands of people at night during December are going to clubs, going to bars, most of them indoors, not ventilated, and you would have no consequence to that. You can't have a scenario where you are aware that people are supposed to be self-isolating at home and they are not. And especially for some of them who tested positive, we knew those things were going on, even from travelers who arrived. So it wasn't difficult to imagine that we would see an upsurge. What I think has been new in the mix is the very high likelihood that we have community spread of the new variants as well. We know we detected those at Kotoka, but we also know that the testing at Kotoka, it's a good antigen test, but it has its weaknesses. The manufacturer itself says for every 100 true positives you test, about 12 of them will be missed. So you add that in place to the lack of quarantine, you can see how we would already have had transmission rising from the campaign period to the holiday season, but the consequences of those infections has now changed because it's apparent that we do probably have community spread of these strains, and that community spread would explain why we're seeing much more severe infections in younger people with no pre-existing conditions. The president said that when he announced it, and it was actually almost verbatim what the South Africa health minister said when they announced the discovery of the strain in November as well. We're seeing that obviously, like Dr. Yankson said, the healthcare system is overwhelmed. That doesn't happen if you have low rates of infection. You either have very high rates of infection or you have a change in the severity of the disease. So all the things that we're seeing now were predictable from behavior and policy choices we're making. The question now is what can we do? And I think Dr. Janssen, Professor Wandari at WACDEP have been saying for a while now that we cannot continue doing what we are doing here. We can't keep having a situation where there's still mass gatherings happening, because it's not enough to say people should wear masks. It's, like I said a couple of days ago, it's mask and social distancing, mask and hand washing. The mask is not a silver bullet. So if you're wearing a mask and you're still going to an indoor event with 300 people, you are still at significant risk, because we also have to be aware that the surgical masks and the fabric masks that most people wear, they are really source control masks. They're meant to prevent people from putting out particles in the air they are asymptomatically infected. They are not terribly effective, or they are fallible when it comes to protecting you from virus particles in the air. The surgical mask will prevent about 80%. The fabric mask about 50%, but N95, KN95 masks do much better. So if you're wearing just one of the masks that are common and you're in an indoor space that's a risky setting, you shouldn't think you are in a position where you can't get infected. We need to communicate around those things better. Make sure people understand that if you're an employer, you can have people at home. Please do that. If you are an employee who has the option of working from home, please do that. If you don't have things to do outside of your home that are critically important, you shouldn't be doing them. And in addition to that, we also need to see the public health measures scaled up. It's great to see this directive about the free testing, but we have to be mindful that there's also the referral requirement. You either have to have it prescribed by a doctor or be identified as a contact. That in itself is a bit limiting. So the sooner we can get more diagnostic options available, like low-cost antigen tests, and expand access to the PCR test, the better. Then we can do contact tracing. Then we can actually do effective and quick isolation and quarantine and have a shot at this thing. Because if all the things like Dr. Yankton was saying, we're not seeing an improvement really in mask wearing and behavioral changes. I was visiting my parents this morning on my way back here in East Legon. There are lots of social gatherings happening right now. You can see cars lined up by streets. The event venues are packed right now. Those things can be happening right now. And if we keep doing those things and we don't do anything to break the transmission, then we have to start looking at our blunt tools. And the blunt tools are the ones that cost the most economically. That's lockdown and other things. So if we want to avoid that, then we have to actually have a policy in place that reflects an active effort to curb transmission. And on top of that, have an enforcement mechanism to make sure that they are working. And it's not just law enforcement, it's about making sure that if you say you're going to do free testing, are you scaling up lab capacity to make sure that people can actually get the test and get it in a timely manner? There's no utility to having a test take a week, because the contact tracing and all those things that would have been effective there would no longer be effective. So those are the kind of things that we have to think about now and try and reduce transmissions, because we cannot be relying on the healthcare sector alone, clinical care alone, to deal with this problem. It's not fair to physicians to make them have to do rationing decisions about who gets oxygen, who gets a bed. It's not fair to them to also have them exposed to the high level of risk, especially when we know that if we have these strains in circulation, at least the South Africa one, it does appear to have some ability to bypass existing immunity from the previous strain. So we have to be considerate of them too, of their professional work environment and their safety, and what they can actually do as by virtue of their human and logistical limitations, and just make sure we're trying to put down the infection rate.
All right, thank you, Nana Kufi. I'll come back to you in a bit. Let me also talk to Professor Alfred Yosin. Prof, we spoke last week. The situation has not improved this week, and frontline workers are issuing dire warnings that if we don't find a solution to this problem, we could be in for the worst, if we are indeed not entering the worst period.
Yes, as my colleagues have said already, it is becoming increasingly difficult for the frontline workers, especially the persons taking care of the severely ill and the critically ill patient. Because this, as the doctor in Rick rightly said, they have a large number of beds with only few critical care nurses. And this is the same story across board. You go to Gan East, you go to the New Infectious Disease Center, you are in Kolebu, Kompoanochi, all that. We have very few of these skilled nurses and doctors around. And this is a major challenge. In the initial phase of the pandemic, A lot of cases were asymptomatic, mild to moderate, and the system could cope. But now we are getting into a phase where the severely ill and critically ill numbers are increasing. And that is where we need as a nation to look at and build capacity. It is becoming increasingly difficult, and we need some short-term quick fix solutions. Organizing in-service training, organizing short-term courses. You'll be surprised to know that we have several medical officers sitting at home who have not been engaged by the system. And these are persons with skills, same for nurses. We need to get these people on board, train them, give them some quick fix training so that they'll be able to help fix these current critically ill persons that we have. We need to do something different from what we've been doing so far in terms of the human capacity and in terms of the way we see the case management. We need to bring in more hands. We need to bring in more persons who can relieve the health workers. These health workers gradually are becoming tired. They work long shifts, 12 hours, and some continue 24 hours, 36 hours. These are humans, and they may gradually become prone to errors and at risk. And if we begin to have these critically few persons also becoming infected, then we are in for a much more increased problems on our hands. And we need to, as a system, MOA, Ghana Health Service, we need to have a paradigm shift in the way we are approaching the management of COVID. I think it is time now that we build capacity for the numbers that will be capable of taking care of the critically ill patients. That's why the mortalities are inching up, because persons who need these services are not getting these. The functional bed is not only to say we have so many number of beds. How many of these beds are functionally able to take care of patients? That is the point. It's not just beds. It takes beds, it takes equipment, it takes human resources, and it takes human capacity to provide these services. So I think it's taking too long a time, and at this critical stage, we need to see some seriousness. We need to see something being done differently. We need all agencies on board, as you rightly mentioned. Health alone cannot manage it. We need the support of, for example, Ministry of Finance efforts to recruit and get these health workers who are sitting at home on board now. We need these people. And also other agencies, like you mentioned, corporate agencies, we should put in measures, try to, as much as possible, limit the number of persons who come to the office every day. If people can work from home, so be it, all the better. And also, in the aspect of enforcement, we continue to say that it's really now impossible to enforce the current law, that the executive instrument that is in place. How many people can the police arrest, and what is the capacity? There should be a second look at this, right from executive, from parliament, to make it reasonable so that we equip our security officers, the agencies, to be able to provide sanctions on the spot in whatever way possible, so that we don't have to, you put people together and you are rather increasing the risk. But if you are able to, for example, get people, sanction them on the spot, get them to do something, and afterwards, we give them at least cloth masks. That is a positive attitude. The point is to prevent people from spreading. It's not just seeing people punished. If they get punished, and through the process of getting them punished, you rather spread the disease. We've not done anything. So I think we seriously need to look at all these measures, and also bylaws from district assemblies, local assemblies. Let's give them that backing and authority to do things that is locally feasible and practicable. Let's continue to engage our traditional authorities. We've always been saying it. It is crucial. Market queens, queen mothers, these are powerful people in their own stead. And to regulate markets and all that, we need the support of these people. And it is high time we give support to the district assemblies to regulate some of these things. That will be my initial thinking. That's
interesting thoughts you shared there, and it's a question I'm bringing to Dr. Yankson as well, on the education and the tone of the messaging, and also the traditional authorities. This week, we saw, I think it was the Ogwa Hene also, the chief of Cape Coast, who personally went into town to educate people on COVID, give masks, and this is one of the more prominent paramount chiefs we have around, and I guess it sends the right kind of message to see somebody like that. So imagine an Ochihene who we've seen do a lot of things with advocacy out there. We see La Manche or a Gamanche or one of the more prominent Asante chiefs, if not the Asante Hene himself, on the streets telling people, look, this is what the problem is. And it brings me to the messaging. There are people who have said they are not very comfortable with the government's current tone at these presses it organizes, because it's a tone that is reminiscent of round one: spread calm, not fear. Is that still a message that should be spread right now? Spread calm, not fear. Should there be a twist to the communication we give the general public?
Well, I wouldn't be in a position to assess the way government's communication is handled. But what we believe in as an association is that the people of Ghana should know the truths. They should know the situation as it is. It is there, and it's up to all of us to do our best to ensure that we stay safe. So we need to carry the message as it is to our people. And like you said, it is time all hands are brought on deck. The local assemblies, the local or traditional authorities should also be up and doing. The center or the national level cannot do it all. And I think it's a good example that the Omahene of Cape Coast actually showed to all of us. This is true leadership by example. Hitherto, some leaders were rather doing all the wrong things and wanting to be praised for doing the wrong things. We are in very dark times, we are in critical times. These are not normal times, as the president always tells us, and we need to bring all hands on deck. Leadership at whatever level of our society should exhibit the right leadership and get our people saved. Look, what is happening in the United States, what is happening in Brazil, what is happening in the UK and what have you, we are not far from that. We are not immune. The situation out there can equally play out here. And this is not about being a prophet of doom or anything. It is just about the science, the virus and what it does, and the way we behave. We were lucky with the first wave by and large, but even within that space, we did our best, and the whole world praised us. For this second wave, we need to up the gear. We don't need to think that times are normal and do things the way we did the first round. We learned valuable experiences. We should bring them to the fore. Whatever we need to break this current trend of transmission is what is important at this point. And like my brother said, the short term, we need not fail. Those quick fixes, we need to do them and at least help stabilize the situation. Because if you want to wait for the curative aspect, we don't have the capacity. Our healthcare system is very fragile. We cannot afford to have more cases on our hands. Even now, we're on our knees. That is the reality.
And Professor Yeltsin raised a point that I recall. I interviewed you last year when the COVID had started, and one of the requests that the GMA had made was for a lot more health personnel to be hired and be brought back.
Yes.
And he has just mentioned that because it's not something I've heard the GMA talk about now, that even your case count has gone up. It didn't appear in your statement.
Look, you see, Godfred, the thing is that...
Shouldn't you be pushing that now?
No. Godfred, hold on. The issues are very simple. You know, things are in the flux. You remember before our last release, almost 8-9 days earlier, we had released another one. So at any given point, we are looking at the situation, we are giving advice, and things keep changing. So it is not possible to have one message
with so many things
in all the communications. No. But what you are saying is really important, because you see, it is not just COVID. We still have the non-COVID problems that as a country we're grappling with before the onset of COVID. those problems are still there, and we need people to address them. Hitherto, our patient-doctor ratio was nothing good to write home about. It was poor, even in places like Accra. So the need for staffing to be improved cannot be overlooked under any circumstances. If we have people sitting home who can help all of us manage the situation, we need to bring them on board. I know some nurses that were employed last year, and they are doing a fantastic job as far as COVID is concerned. I was part of their trainings, so I observed some of their trainings, and I know they are still working in the system. So if we have others sitting at home, doctors, nurses, all other health professionals who can contribute, we need to bring them on board. It is very important.
Okay, hold on for me there. Franklin,
yeah,
you are the regular citizen perspective. What have you made of the recent high numbers we have seen and the warnings coming in from the health personnel? And also talk to me out. Dr. Jansen says he can't talk about the shaping of government's communication, but I'm sure you can.
I didn't say I cannot talk. I said I will not evaluate it. But
yes,
what we need to do, because the people have already given their verdicts.
Yeah.
The people of Ghana, they are the ones that government is serving. And if they think that government's way of handling the communication is not the best, they are right to say that. But what I was saying is that I wouldn't even focus so much on how it should be done. But the truth is that the principles should be upheld. One, let the people know the situation. If it is there, let them know. If it is good, let them know. If we all know that, look, the deaths are happening, let's put it out there for people to know that the deaths are happening. If our testing capacity is low, let's put it out there, because this is where we are as a country. For me, those are the principles that I was espousing.
All right, I get you. Thank you. Franklin.
Well, I mean, Dr. Jansen and Nana and Prof. Yosin have all confirmed what one doctor from Reach who called me, I think a couple of days back, to warn me to be very careful, because the strain now is responsible, the new strain he believes is responsible for the deaths. He painted the picture of very apocalypse, really, and I was worried. Worried because it appears we left our guards down. I mean, if I had some communication that, well, the political rallies did not encourage or did not help increase the infections, and that there were other issues. Well, of course, there were parties as well that were organized. It presupposes that we in fact have failed on all fours, and I do not just have to blame government communications or government itself, but even we, every ordinary citizens ourselves, we've also not been upholding all the rules or the tenets or the protocols that this pandemic had brought upon us. Look, we were going to organize a program on Thursday. We had almost 125 people signed up. Then I had to, when all this was happening, I had to quickly, 48 hours before the day, I think 48 to 72 hours for the time, I said, no, we should move it online, because we don't want to be seen to be encouraging the flouting of rules, you know, and so we moved it online, and it was a successful program. I'm encouraging everybody, everyone who has anything serious to do outdoors, to reconsider. By that, I could also be asking if the schools, I don't know, because now that we are told that children can be child carriers and they could also be affected, the question I have is how do we handle all of this? Children in school, and some of the schools obviously have issues. I mean, that's what the public schools, the least said about them, the better. I mean, I saw your own newsreel on some of the public schools, I think in Adenta area or something like that. And the guys were just happy-go-lucky persons. I mean, they were going about as if they didn't care. And the headmistress said, well, she can't prevent people who need admission, and she has no tools to fight the COVID. It is there, and I suspect that we need to be serious about it. That's all I've got to say.
All right, let me come to you, Nana Kofi, so that we wrap this up quickly. and then we can move on. You've also spoken about data management and how we need to improve the data. Why is it key that the data catches up with the situation?
Well, it's important to give people an accurate contextual understanding of what's happening in real time. That's important for people's understanding of the current risk and for the appreciation of the seriousness of the situation. I'll use an example of testing data. We recently heard that Ghana is stabilizing at about stabilizing at about 600 cases. But it's important we communicate that in the appropriate context. It's not to say that there are only 600 cases detected in Ghana, or that the total that we are testing continuously and only finding 600. In fact, quite the opposite. If you look at our 7-day average of daily testing, in the last few days, when we just started seeing it begin to stagnate. So if you're seeing your testing stagnate, you expect your cases stagnate. The interesting thing is that even though the testing has stagnated, it's a big improvement from last month. It's stabilizing around 4,000 a day, and we're getting about 600 cases a day out of that. If you look at the contact tracing group, it ends up being about 20% of what tests done end up being positive. But if you look at what we call the positivity rate, so like I was saying, every 100 tests we do, how many come back positive, that is still rising. We're currently almost at 20%. That's 1 in 5 people. For context, in the United States, in Germany, other places where they're having a great deal of panic right now, their positivity rates are under 15%. So we have to put ourselves in the appropriate global context when we talk about those things. Then you have also the question of how seriously people view COVID-19. You have a lot of people who routinely, online, sometimes you point out something, people come and say, scaremongering, blah, blah, blah. But if the notion is that people aren't dying, that data that we have there is quite behind the pace of the reality. So if you want to communicate to people that it's serious, that people are being hospitalized and stuff, that has to be current. In August, when I was tracking the delays in the publication of that death data, it wasn't uncommon to have delays as long as 79 days, 80 days between when it occurs and when it's actually reported. Yes, of course, we have a review process to verify, or study the deaths as we were told, but it's hard to understand how that takes 79 days, how it can take a month sometimes. We need to make sure that data catches up so that when people are going around saying things like, oh, but it's not that serious, people are not dying, they understand that that's not true. Like Professor Yorson said, like Dr. Yankson said, the hospitals are overwhelmed. And part of why we're seeing the rising mortality is because the healthcare system has reached its capacity and it can't do as much as it should do for all the people who need the care. If we don't communicate to people that those things are happening, don't communicate, show to them in their numbers, don't contextualize the information for them so they understand that this is not a time for you to be thinking everything is fine. This is a very dangerous time and you need to take it seriously. And the communication, including the data management and the data reporting, has to be current enough that when people are making the case, when public health professionals are making the case to lay folks, that lay folks are not then interpreting the information as that, there's nothing wrong, things are not that serious. So we need to, like you were saying earlier about the communication question, I happen to think that we can do a lot more of the communication, contextualize it appropriately so people understand the risk, and move away from the question of trying to tamp down panic. You want people to have a candid awareness of what's going on. Whether people feel pessimistic or optimistic about the situation is irrelevant to the science. The science is what's driving this. So we have to communicate that appropriately, engage, like has been said here, traditional leaders and other things to make sure that we're getting timely data, we are explaining that data in the appropriate context so that people, and in a way that lay folks can understand, that they can then go as traditional leaders, as religious leaders, and communicate to their people that we're in a serious situation. This is not the time to be, it's a time for, people of faith to be serious about their faith and all that stuff, but we also need to do the basic public health things. So we all know that there are things that can be done. There are people who are responsible for them. They should be held accountable for doing those things, and we should insist that they get the right things done. That includes the data management picture as well.
All right, let me come back to you. Professor Jansen, just give me a second, I'll come back to you. Dr. Jansen, there are a couple of questions I want you to answer for me quickly on this. We've seen people do a couple of things. So in the first round, because since we can't see a second wave, can we?
Well, this is the second wave.
It
clearly,
is?
Yes.
We can say so?
Yeah, this is our second wave.
Okay, so because I tend to choose my words carefully.
This is our second wave.
We are in a second wave. during the first wave, we saw this steam inhalation and whatnot, and it's become pretty popular. I woke up this morning and I saw lemongrass and some things lying in my corridor, apparently getting ready to be used. Is it useful? As from a medical perspective, because it's become the thing. People are doing this everywhere.
You see, the problem we have with what is happening is that you don't even know the sort of ingredients that people are using. It's not just the steam, as you say. People are adding all kinds of concoctions. I heard people say they are using naphthalene balls and what have you.
They're using what?
Naphthalene balls, camphor.
What?
Yes. So the issue is that, please, let's take to the basics, i.e. the preventive mechanism. That is the best for us. Eat well, get some good stuff that will help improve your immunity and all that. All these claims, most of them are unverified, but people believe that it is working for them. And it is very difficult to say that their beliefs should be thrown away. Health itself, sometimes you need a certain component of belief, but you also need to situate it within a certain context. So where there is no worldwide or generally accepted principle that this particular activity will make sure that your viral load is low or will prevent you from getting, depending on how people use these things, some of them could end up having problems as a result of the sort of ingredients they are using for all these activities. So it's a very funny thing. There is enough scientific knowledge out there that seek to debunk some of these things. But the consensus is that we all need to be very careful and measured in what we do.
Question 2, hydrogen peroxide.
Well, this has come up. There have been a few publications, one in the British Medical Journal. There's been some bits done by the Italians. Our own Professor Ite and his team, they have also done certain things. Based on the research and the sample size they use, they have drawn the conclusion that they think it will help to a large extent in this fight. Of course, like I keep saying, within the scientific community, there is no unified position on this. But even beyond that of propriety and the Italians, what has happened in the British Medical Journal, some doctors in the States have also made some pronouncements on hydrogen peroxide. Because this is a new disease and we are all doing our best to get to the bottom of it and make sure that we have a cure, research findings cannot be discarded just like that. Whatever value or whatever importance that can be obtained from them, at this point, we need to look into these things further. And I'm sure Professor Ite and his group will tell you that they are looking at doing a lot more research for us to have a bigger sample size that will give us some result that we can all say that, look, these findings cannot be contested in any way. But the results so far, I think, are quite positive. If the trend should continue that way, it may help in the battle as well.
And on vaccines, it's basically the next leg of this. Everybody's asking, the government has assured us the vaccine is coming. Does the government keep you in the loop about vaccines and which ones they are choosing and how it is even going to be deployed? Because we have seen that normally it is frontline workers who get the very rare doses that are coming out this way at least.
Well, let me be candid with you. I am part of the EOC, the NTCC, as far as these COVID activities are concerned. I know for sure that some work has been done on the vaccines. We even have policy, draft policy in relation to the vaccines in place. It is being discussed at the highest level. I have read the details. I've also had conversations even this week with the Minister Designate for Health, with the Director General Ghana Health Service, and even some other private sector stakeholders. So clearly some work is being done on the vaccines, except that we don't have them.
Should we be hopeful?
Well, we have no option than to go for them because that is the only way forward now. We need to prevent ourselves from getting the disease. Herd immunity is not the way at this point. We are nowhere near it. And clearly, even if herd immunity was going to help us, with the current trend where we are saying that the sort of immunity that you get from COVID infections itself is limited. 3 to 5, 6, 7, 8 months maximum. Because we are seeing cases here in Ghana who have had COVID, for example, for a second time or a third time. So clearly, in terms of the natural immunity that you develop out of it, it doesn't last long. So the vaccines have become the way forward for all of us, and we have to brace ourselves up as a people for it. Wherever we need to get resources from to get the needed vaccines for ourselves, it is better than just deciding that you are not going to go for it. It won't help us in any way.
Okay, thank you very much. Let me just take a couple of messages and then wrap this up. Hi, this is Pentani from Garu Government Hospital. From Garu, the government needs to recruit more health personnel to help the health facilities so they can manage COVID-19. If not, a lockdown will lead to economic crisis. PK from LML says, my heartfelt condolences to all members of the NDC. Now, with COVID-19, at a point in time, Ghana last year, we were told that COVID had gone down and that the government had done the best management of an economy where there was a COVID crisis. Here we are, and the disease is spreading rapidly. Okay, somebody says, good morning. What's happening in our motherland now? Our leaders, why? The lower primary and KG must stay home. This one also, okay, this one has to do with the UDS one. But yes, on the kids, there are those who say, yeah, the numbers, we are seeing the numbers in Kumasi now where a lot more kids are being infected. And there are those who say the kids are super spreaders. I don't know what the science says. So they might not be infected as much, but they spread it really, really quick.
Well, you see, during the first wave, what was clear virtually globally was that the youthful population were not being infected compared to the adult population in terms of numbers. But with the second wave that is moving around the world, it has reversed. We are seeing a lot more of the younger people get the disease. Hitherto, we're talking about people who had underlying disease are the ones who were most likely to have the severer forms of it. That is not the situation anymore. So locally, we are seeing younger people also getting infected like it's happening elsewhere. And like you said, the kids can be super spreaders because they are always, you know, in that playful mood. They bound up together. They might not even understand the importance of what we are saying, especially for those in the very, you know, lower age groups. So clearly, we need to make sure that we protect the kids as well.
Okay.
They are also not immune.
Okay.
Yes.
All right. Thank you very much, Dr. Justice Yankson. We'll take a quick break. When we return, we head to the Supreme Court. Welcome back to the big issue. And as you can see, I've masked up. And I've masked up because I'm no longer alone in the studio. I am here with Nikpapu Samoa, a private legal practitioner, member of the NDC, and Gary Nimakwa, also a private legal practitioner and a member of the NPP. And we are heading to the Supreme Court because after weeks of, one would say, local terms, they call it skirmishes. The actual case started yesterday, one would say, with cross-examination at the Supreme Court. And on Friday, a couple of things happened. So we will hear a bit of the legal arguments that took place in court, and then we'll come back and try to make sense of what we saw from both sides.
The petitioner opened his case in readiness for action.
I, Johnson Asiedu Nketia,
do in the name of Almighty God swear.
Do in the name of the Almighty God swear.
That the evidence I shall give.
That the evidence I shall give.
In this case.
In this case.
Shall be the truth.
Shall be the truth.
The whole truth.
The whole truth.
And nothing but the truth.
And nothing but the truth.
So help me God.
So help me God.
Lost SOD in English.
Shortly after that, the objections started.
We are objecting to certain paragraphs or parts of some of the paragraphs in the witness statement of Mr. Johnson Asiedu Nketia. on the ground one, that they are not based on the pleadings. 2, they tend to unduly prejudice some of the parties to this suit.
I have to say that, I mean, these attempts to, take out of our witness statement extremely material matters that relate to the case that is being presented by the first respondent, I mean, are really matters that we consider, really very, very seriously.
Out of the 10 objections raised with paragraphs of Johnson Asiedu Nketiah's statement, the court ruled as follows.
The first and second respondents have raised objections to parts of the witness statement of Mr. Johnson Asiedu Nketiah, who has been sworn in as PW1. The objections to those paragraphs, precisely paragraphs 21, 6, 7, 25, 26, 28, 30 and 32, 33, and 37. Both counsel based their objections to the paragraphs in the witness statement of PW1 on 2 grounds. A, that some of the paragraphs under attack are not based on the pleadings on record. B, some of the statements are unduly scandalous and prejudicial. The court therefore orders the paragraphs referred to as offending the law are hereby expunged from the witness statement of PW1.
Having settled this, the court heard the cross-examination of the witnesses.
So it is right to assume that your agents had all the Form 10s with them. Is that correct?
Come again, my lord.
I'm saying that it is right to assume that based on your answers, your agents had the Form 10s with them.
Yes, my lord, it could be assumed.
Right.
But whether that is the case is another matter.
Then the figures had to be computed.
If you add up all the valid votes assigned to all the candidates from number 1 to number 12 on the form that your agent signed, the total should be 1196751 and not the 1236940 that was written on it.
My lord, I can confirm that the totals are not the aggregates of the numbers there, but I don't remember the actual figure that I got. If the court will permit me, we can add and find out what it is. Yeah.
So you just heard and watched excerpts of what happened in court. And like I said earlier, Gary Nimakun is here. He's the one in red. So in the red corner, you have Gary Nimakun of the MPP. Gary, good morning.
Good morning, my
Happy
brother.
New Year. We haven't met.
Yeah, that is so.
In the new year. I've been hearing your voice, but we haven't met.
Yeah, that is correct. In fact, we have been dealing with this diabolic man on my left hand.
Clad in black in the blue corner. but what Gary, let me start from you.
Right.
You want to start?
No, I think I should start because they are the ones claiming that they won elections. When they did, they never won elections.
Let
me start. Let me start. Good morning to you, my brother. Good morning to your cherished viewers. Good morning to my brother. Good morning to Sika Abla Ado, my own beautiful princess and the wife of me, Apu Samuel Ado. Mr. Godfrey Akoto-Boafo, this country went to elections December 9th, presidential and parliamentary elections. As a matter of fact, prior to the elections, there were several statements here and there, press conferences here and there, all to seek to impugn the integrity of the Electoral Commission and the chairperson of the EC, Mrs. J. Mensah, whose middle name Adokwe has been a matter.
Adukwe
has been a matter for an issue of its pronunciation in court.
It's called Adukwe.
Now, post matters prior to the elections. The actual D-Day happened, elections happened. On the 9th of December 2020, declaration was made, declaring His Excellency Nana Akufo-Addo the President of the Republic of Ghana elect. Mm-hmm. This was subsequently gazetted by the EC chair as the returning officer for presidential elections. We were now informed by NDC apparatchiks that the elections was flawed. His Excellency President John Dramani Mahama has won the elections. And when these figures were being turned out, and I kept wondering whether, as a matter of fact, it is true that the elections had indeed been won by His Excellency President John Dramani Mahama, former. Now, Ghanaians were made to believe this fact. Supporters of NDC were thrown into the streets. There were demonstrations, burning of ties here and there. And some of us kept insisting that when you dispute presidential election result, the best way for you is to go to court. If you don't go to court and you are just, ranting all over, then burning ties, demonstrating and all that, it will not serve your purpose because it cannot change the result of the elections. The only forum to vindicate your grievances is the court. I think about 2 weeks to 3 weeks of demonstrations, including members of parliament demonstrating, we were now informed that the NDC, now I'll put it this way, that the John Dramani Mahama, the petitioner, has filed a petition before the Supreme Court. Then when I read the relief that they were seeking, let's just forget about the amendment that they did because, clearly we all realize that you cannot have election between the Electoral Commission chairperson and John Dramani Mahama. That was an error. Yeah. Which, even though others have made errors which they have corrected, and they are not willing to accept. But when they made the error, the Supreme Court was gracious enough to allow them to correct their errors. Now, in the Supreme Court, I thought that they have sold the news to us that they've indeed won the elections. Then the Supreme Court, they said they have not won the elections. But then now, no one won the elections. And they want a rerun of the elections. What a dichotomy. A sharp departure from what they've told Ghanaians. They told their supporters. And for that reason, the supporters were on the streets, chanting. Now they say they didn't win the elections, but now they want what? A rerun of the elections. And I asked myself a question. A rerun of the election based on what figures? Because before you can ask for a rerun of the elections, you must be able to tell all of us that I garnered X amount of vote, Y garnered X amount of vote, and therefore, in our view, you say you want a rerun of the election. Yesterday, we were not confronted with a very serious matter. That the Senator says that they are not in Supreme Court to say that they want a second declaration of the election results, but rather for the court to declare on the unconstitutional activities of the EC chair and also to pronounce on those matters. You see, court going is not a small game. As for being on the streets and making noise, you can do it. But court going is about the facts, it's about the evidence and the law. Without the facts and the evidence backing your case and the law supporting your case, it's much ado about nothing. Now, let's make progress. This case started with interrogatories.
Now the dispute over them.
Yes. Now they serve questions on the EC chair. The 12 questions you will come and answer. And when I run through the questions, I ask myself again, these questions, can they be put to the EC chair in cross-examination? Because these are questions that you can see. The answers are embedded in the answer they have given already before the court. So if you think that the answers are not enough, they are scanty or they are sketchy, as they put it, when Mrs. Jameson mounts the box, you are at liberty to ask the questions. Put the questions to her in cross-examination, let her answer the questions. The court dismissed the interrogatories, they said they don't understand. Then they filed for review of that decision. The Supreme Court, in its wisdom, had a review application by adding additional 2 judges to the original 7-member panel, and then by unanimous decision of 9-0, again dismiss the review application. Now, clearly, what does it tell you? It tells you that to say that a decision of a court, Supreme Court for that matter, is subject to review, you must demonstrate 2 key legal criteria. One, you must show that there is a manifest error of law which the decision has occasioned. And 2, that error which has occasioned has caused you, the party, miscarriage of justice. Clearly, these 2 thresholds, they couldn't meet the 2 threshold to urge the Supreme Court to overturn the 7 justices to even get at least 4 to their side or 5 to their side to make it 5-4. So these were also dismissed. Now the way is clear. With all the legal gymnastics and the antics, the way is clear. And the way became clear yesterday with Mr. Seyidu Nketia mounting the box. Before even he mounted the box, certain matters came up.
Yes.
Which I want to explain as well.
Yes, what happened with Lawyer Kutampa? What was his problem? When it comes to civil procedure, my brilliant friend sitting here will bear me out. If he's a criminal practitioner, I am purely into civil litigation. So he himself is aware when it comes to these areas. You can't play with me. And I've been doing cases doing his case for him. Civil cases, so he knows. You see, you file your pleadings. The pleadings is your case before the court. The facts that you put before the court as your case, we call it pleadings. You file, I respond. You also respond. So you have EC being first respondent, and Akufo-Addo, His Excellency second respondent, petitioner being Dramani Mahama, also a petitioner. He filed his case, he put the facts down. These are the material facts upon which I'm in court. Same was done by all parties. Now, you file your witness statement. Witness statement clearly is just a narration of what your case is. And it is contingent upon the pleadings, that is the facts you put before the court as your case. You can't file a witness statement outside your case. You cannot file a witness statement outside the facts that you have put before the court already. So if you file with a witness statement and matters that you have not pleaded, that are not captured in the witness statement, in the pleadings, you go and bring them in the witness statement, those ones will be struck out because they are not part or born out of the pleadings. That's what happened, you see, at the first one. So they are now introducing facts, certain facts which were not captured in the pleadings itself. Therefore, the court was right to expand those ones from the witness statement. 2, when you make certain scandalous statements, certain statements that suggest that some wrongdoing or something to impugn somebody's character, you make those things in the witness statement, the court is in the right to strike them out as scandalous pleadings. And those ones should be struck out. Even before you can even start mounting your case to give evidence. Now, those times before, when there was no introduction of witness statements, what was going on was that you come to the court, then you make a verbal narration of your case. So you start, I live here, I come from here, my case is this, and you go through the long litany, and so delaying court proceedings. So we borrowed from England, and I said, no, now you put your statement, what you're going to say, tell the court, put it down on paper. So once you tender, and it goes into evidence, the lawyer on the other side will now cross-examine you based on your own witness statement. Okay. So now the way is clear. All those scandalous statements have been expelled from the record. All those facts were not pleaded, which were now surreptitiously
surreptitiously included as part of the witness statement, the court in its wisdom have taken them out. So the way is not clear. Questions are now being posed to Mr. Sedin Ketia. And you see how interesting it was yesterday. And I was surprised.
What surprised you?
Collation of regional resource that their agents were signing. That the agents were signing, 13 out of the 16. The agents were signing and agreeing. In fact, the one also a national collation to their agents were there. Roger Metinunu and my own good friend, Professor White. We are told where they were there. And they were signing. And then we are told that at the point in time when they realized that the election is lost, they left the place and went away.
That is the narration of the other side.
Of the Electoral Commission. I mean, and then you ask Mr. Sedin Ketia, he said, well, I was not there, so I cannot testify about them because I was not there. But yes, it is true you were not there. But you were not there, but you told Ghanaians that, as a matter of fact, you have won the elections.
Based on numbers they had.
Yeah, but yes, and yesterday when you were asking whether indeed they won the elections, he's now veering off from that
I don't think he has veered off, Gary. He's saying that the numbers are in contention.
Which numbers in contention?
The numbers for the reason why he does not feel the elections were won.
You see.
I think he's been consistent. You don't think so?
No. You see, that is the reason why I suspect that the second respondent intends to put certain things, play video or whatever it is, to let Ghanaians know the things they said publicly. And then vis-a-vis what they are telling the court. And you see, the beautiful thing is that this is being live telecast. Ghanaians are seeing what you said on public television, and then they are comparing what you said on public television also to what you are saying now before the courts. Now they are viewing the two streams of information and making judgment of it by themselves.
But it doesn't really matter. This is what the court says that matters. Who cares about what Ghanaians will say in this particular matter?
This case is both politics and law.
Thank you.
This case is not only law; it is politics and law. There's a political psychology to this case. Oh yes. I mean, unless you are not a smart practitioner, that you would think that this case is only law. It's politics and law. I'm telling you that NDC people, if you meet them, and they are my friends, they are my brothers. We meet.
Gary, wrap up round.
They are telling us that look, we are in court because we want to appease our supporters. That's what we are in court.
That's what they've been telling you.
They've been telling me on the quiet, and we are in court because we want to appease our supporters. Because we told them that we won the elections, but now we realize we didn't win the elections. So we must go to court to say, we are in court. We see where we are in court. We are in court.
That's a pretty elaborate process to convince your supporters, don't you think? The Supreme Court.
No, as for the Supreme Court, you can't do propaganda in the Supreme Court. That is why, even though they told Ghanaians that they won the elections, and NDC national officers, I won't mention any of them their names here, to dignify them. They said they won the elections, but they went to the Supreme Court. I thought they were going to say that, yes, we won the elections, but they said, President Mahama did not win. President Akufo-Addo also did not win. And so, court, order rerun or a second elections to be conducted between the two. Hey, so nobody won. But what figures did President Mahama got? What figures did Nana Akufo-Addo get for you to say that the court should order a rerun?
Let me ask you this, Gary, quickly before I go to Liverpool. There was this thing that, and it's what a lot of people were picking on, where Mr. Sedin Ketia, upon cross-examination by lawyer Kotam Pal, basically said he is not the petitioner has to come and answer those questions, or he cannot answer the question on behalf. You can correct me. He cannot answer the question on behalf of the petitioner. He is there as a witness, basically.
What is he in the court for? You are in the court there.
And a lot of people picked up on that. What was that about?
It was question. See, that is the reason why.
People were like, well, if you cannot answer for him, why are you there?
But that is the reason why.
Is it regular?
The court in its wisdom had to expand certain matters in the witness statement, which sought to suggest that it was as if President Mahama, the petitioner, was the one speaking to the Sedin Ketia. Because there are certain matters that is within your personal knowledge.
Okay.
Only your personal knowledge. That only you can talk about.
That is actually the criteria for being a witness.
No, I'm talking about the one that he said that.
It's a part of the fact they say that the criteria for being a witness is the fact that you must have personal knowledge of the matters you are speaking to. That's the basic rule. You understand? So if you you finish.
No, his question relates to the one that he said that unless President Mahama is the one talking about it, he cannot come and talk about it.
And I'm saying that. You see, I'm saying that it was in response to a question that sought to elicit personal knowledge of a matter that was within the domain of Mr. Mahama. So if you call me as a witness, the basic rule, and Gary and I agree on this, we can't even disagree, is that when you are called as a witness, the rule is that you must have personal knowledge of the matters that you will be speaking to. So if the questioner, who is the lawyer, asks a question to you that you do not have personal knowledge of, your duty as a witness is to tell the person that I do not have personal knowledge of the matters that you are asking me, and therefore I'm not in a position to answer. The proper person to answer the particular question you are asking me is the petitioner, not me. And so there was nothing wrong in him stating on record that in response to the specific question you are asking me, it is the petitioner that you should be asking, because I do not have personal knowledge of that particular fact. The facts I have knowledge of, and for which I am in court to testify, is in support of the case of the petitioner. So ask me questions that I am competent to answer. So simple as that.
No problem.
Gary, wrap up. 1 minute.
No problem.
Then I go to Neil.
So
you have plenty of time. Calm
so
down.
bottom line. I think that now the way is clear. All the antics, all the gymnastics, all the interlocutory applications, everything has now been dealt with. The court is now dealing with the matters in contention itself. I believe Monday they are back in court, isn't it?
Yeah.
So there'll be continuation of the trial, and none of us can sit here and prejudge the matter, see how it will go left or right, but we will see how the case spans.
But you are happy with as a lawyer from the other side, you are happy with what you saw on Friday?
Oh, everything is okay. I mean, I don't see anything wrong with what happened on Friday.
Okay.
Everything is okay. I mean, what happened on Friday, I mean, unless somebody wants to just play mischief and want to just, say something happened on Friday, which was not warranted by law. What happened on Friday, everything that went
by the book?
It's by the book.
Okay.
It's by the book. So,
you see,
people are not too impressed with Mr. Sidun Ketia's performance.
What is there to be impressed or not impressed about?
Well, he says that it's both politics and law.
Yes, it's a political.
So the political side allows people to make comments.
I wanted to start with that because in 2012, President Nana Akufo-Addo, and there are videos, it's been on social media all over. After the declaration of the results in 2012, he mounted the platform. On that platform, we had Nana Akufo-Addo, we had Kabo, we had Oslo Kufu, we had a number of dignitaries on that particular platform. It was a rally, a sort of a rally at the Obra Sport. And they mounted the platform. Said that the election results was a stolen verdict, basically. That the results were supposed to have been in favor of President Akufo-Addo. And that in fact, President Akufo-Addo mounted the rest and said that he disagrees with the results. He believes he had won the results. And therefore, and by the figures and calculations that were available to him, he had won the result, and that he was going to the appropriate forum, which was the Supreme Court. You understand? And that particular guy, Osler and Cabo made even further statements, more outrageous.
This was after the declaration?
After the declaration. Okay. That was before they went to court. That video is available. Before they went to court. It's on social media. Before they went to court. I have it.
No problem.
I have put it up on my YouTube, my Facebook page many times. They went to court, and so that was the place where the Joy FM reporters got beaten. That was at that point where the Joy FM reporters got beaten. It was at that particular rally at Obra Sport. And so it was there that they made the declaration.
So what point are you making?
No, please. It was at that point that they made that declaration that they were going to go to court, and so their supporters should calm down. But after that, they had bent a few cars and what have you. The point is this: when you have a situation that you decide as a political party, as the representative, as the presidential candidate, that you are going to exercise a particular option, it is, as he said, both a political and a legal decision, because you have a constituency and a base that you must communicate to. Now, in respect of the 20, and that's the mistake that I keep seeing my colleagues in the MPP keep deliberately seeking to put up a case for the NDC, as if the NDC, and last time he was on the platform with Dr. Ida, a very good mutual friend, he kept telling him that, at least I taught you in school. So, if for nothing at all, do not discuss the case and do not put up a picture that the NDC has so incompetent lawyers that we do not know what it is that we take into the court.
That was when you said we were going to do a review application.
I'm coming.
A review application, which I made him aware.
Please.
And you cannot overturn 7 justices.
Guy, we are, listen.
To your side to make it.
Listen.
No.
I'll give you a back.
Review application.
You see, it has never been that. It has never been, and Gary himself would agree. It has never been that a lawyer goes to court with 100% surety that you win a particular case. Other than that, Nana Akufo-Addo wouldn't have gone to court in 2012. He went to court in 2012 both as a political and as a legal decision.
Okay.
And after that particular case, there was a lot of write-up that pointed to the fact that it not only improved our electoral system, you understand, because of the inadequacies that were brought out. And he was in court over 2 or 3 times after that particular case to further improve the system, including the posting of the results at the polling station. That was a decision that he had to go to court about. Mm-hmm. So the subjection of our electoral process to court litigation is for the mutual benefit of everyone, because it will seek to improve the system.
Okay.
Now, what is it that we are in court about? That is what is fundamental. Mm-hmm. In 2012, the MPP went to court on both substantive and procedural grounds. And that is very important because, you see, and for the purposes of education, it doesn't matter how ironclad a defense you have on the merits of your case. If Gary and I know that I can take you out on a technicality, i.e., the issue of capacity or jurisdiction, mm-hmm. I will not waste my time going into the merits of the case. So the point being that if procedurally you don't have the right, you understand, to initiate the action, for example, or that the court that you have gone to is the wrong forum, it doesn't matter what case you have brought before the court. The court, the procedure of the law is that your case should be thrown out, and it doesn't matter the merits of your case. So, in the same vein, they went to court in that case with substantive issues in respect of the fact that they felt at specific police stations certain things had happened, which, if added or subtracted from the total votes that had been cast, would give a certain result. Some of which were the non-signing of the pin sheets by the returning officers. They had 4 out of the judges consistently agreeing with them that infractions of the constitutional procedural measures, mm-hmm. such as the non-signing of the pin sheets, constituted violations which should have the entire election results annulled. And so that came up with the distinction that some judges were of the opinion that, or were following the strict letter of the law, including the current Chief Justice, who said that the non-signing, the non-signature of those particular pink sheets should invalidate the results of it, and that he was going to apply that strictly. And another set of judges said that it doesn't, yes, constitutional infractions on their own, stricto sensu, are not enough or may not be enough to overturn the results of an election. And that they have a duty to keep the results as they are, because the results are by the police. So you need to do more than just show mere procedural infractions. The NDC's position in this particular case is that Article 63.3 prescribes a certain percentage that you must have as a candidate for presidential election. Mm-hmm. 50 plus 1 in terms of percentage.
You mean a winner or candidate?
No, the winner, the winner of the one to be declared as the winner. 63(9) imposes a duty on the Electoral Commission chairperson as the returning officer to prepare an instrument for declaration of results. Now, the combined effect of these two provisions, in the opinion of the NDC, is that when you make the declaration, okay, first and foremost, the person must obtain 50+1 of the valid vote cast. Do you understand? And so the case in court is actually between the NDC and the Electoral Commission.
Yes.
The NPP is virtually like a collateral, you know, because they are the beneficiaries.
Certainly. That is very clear.
Our point in court, you understand? That is why they keep trying to tell our story by trying to force us to do what they did in 2012, by going for both a procedural argument and a substantive argument that point us out from the lot in the said 30-something thousand police stations where you are led that there have been infractions, and for which we must show you that those infractions, when calculated in terms of an audit, will change the results.
The results, yeah.
President Mahama made two specific points. One, that from our internal coalition, we had won the election.
Oh, okay.
That was one of the statements that our party made. That from our internal coalition, we had won the election. Secondly, there were procedural infractions by the EC.
Can you say that again?
No, I'm coming.
Internal coalition, you had won the election.
I said two things. Two statements were made by the party. One was in respect of the procedural infractions. The second was in respect of what? The audit of the polls in terms of our results. Nobody can force a party, and he's a lawyer, I'm a lawyer, to go to court on a particular curve when he has multiple courses of action open to him. I can choose which particular course of action to elect to go to court with. Okay. And he knows it. That nobody, as a lawyer, no one can force, no, I cannot, if he's doing a case with anybody, he chooses what to file based on the best interest of his client. And he and I again agreed that if I have a procedural matter that has and can have the effect of dismantling an entire case, I do not need to go with other ancillary issues. So if the procedural matter that I have raised is enough to deal with the issue, why should I come with other substantive matters? You can't force it on the person. And so no MPP communicator, lawyer, for that matter, can force President Mahama to go to court, you understand, with their set of facts and their courses of action. It is not open to them to dictate to him how his lawyers should proceed. And for the matter, Mr. Chatuchikata, who has even lectured as it is now, all the members of the bench there, none of them can force him to decide which particular course of action to take. Based on a technical review of the options available to Mr. Mahama, his lawyers advised him, go for this particular one. And he decided to go for that one. Okay. Now, what has he gone for? Article 63(3) is clear in respect of the 50+1 requirement. Now, is it true that in making the declaration as to who had won, the Electoral Commission head made mistakes in respect of the figures that she gave out at the time of declaration? That is what is material. The Electoral Commission is a commission head. Nobody else in this country. And that is why Mr. Chatuchikata was very, very clear that it is not as if we are personalizing the action against her. But she is the returning officer. The Constitution makes it very clear. And the Supreme Court has consistently upheld that particular principle, that the EC is independent to the extent of its work and mandate. No other body can force it to do things the way we think. We can even have a perception that they are doing it badly. That's what's happening with the, what do you call it, with the register. But they will not impose how they should do their work, but they must do their work in conformity with the constitutional provision.
Okay.
Our case in court is very simple.
Okay, make it simply.
Now I'm coming. That's why that
you
50.
Have 3 minutes.
No, I'm coming, please. 63(3) talks about 50+1. Did the Electoral Commissioner make mistakes at the time of declaring the results that makes it possible to say that she did not declare the results, that makes it possible to say that Mr. President Nana Akufo-Addo, at the time she made the declaration, had obtained the 50+1 of the valid vote cast. Now, what is interesting is that the Electoral Commission, the Electoral Commission has admitted that there were errors in the declaration. It is not even in dispute because she actually made the declarations on the total vote cast and not on the total valid vote cast.
But isn't that the point where...
And that is what is interesting.
Lawyer Manuva said that at the time of the NDC filing their case, the
not
corrections had been made.
No, you see, the issue is this. So we go back. What is the legal way of amending results that you have declared that are what? That are faulty? What is the legal way? We say that she did not conform to the procedural laws available.
Okay.
What is at stake is, will the Supreme Court, even if in agreement with us, you understand? That is why I have done a case where a sitting Chief Justice has been found to have acted unconstitutionally, but the court says not all unconstitutional infractions will lead to you having a second relief, which is the annulment of the action that you complain of. So yes, you can get a declaration that the person acted unconstitutionally, but we will not, that was in the Anas case, we will not invalidate the petition.
Simple.
It can happen. You understand that Madame Jane Mensah may have acted unconstitutionally by making mistakes in her declaration, but will that amount to annulling the result of the election? Those are two different things.
Okay.
The NDC's position is that we've gone to court, we have made arguments, you understand, seeking to show that under Article 63.3 and 63.9, the EC Commissioner acted what? Unlawfully, right? And unconstitutionally. And because she did not act constitutionally by declaring the results as prescribed by the constitutional provision, in our opinion, none of the candidates that stood in terms of the two highest candidates obtained the 50+1, and therefore there should be a rerun. It is for the court to decide whether our arguments are legally sound or not.
Okay.
But when we have our friends keep making the point that we should do the case the way they think should be,
what they have said?
That's the attack. The attack has been that, oh, we are in court and we are engaged in theatricals and we are delaying the case. I am waiting, and I ask everyone to wait for the cross-examination between Mr. Chatushikata and the Electoral Commission head. It is going to be a fantastic cross-examination.
Let me come back to you, Guy.
Guy himself knows it's going to be an interesting cross-examination.
well, I mean, we are enjoying the courtroom litigation, and let me be very clear with my brother Nipapo Samuel. You see, I've listened to him attentively. He says that the percentage of 50+1, nobody obtained. But they did the internal collation. See, now the arguments are in two tranches. Their internal collation that they did, NDC had won the elections. Now, again, as a lawyer, no one will choose for him the path they should take to go to court to say they have won or they want a rerun. They have chosen the path to say they want a rerun. But the question I ask myself is that if indeed you won the elections, why are you in court saying that you did not win and you want a rerun? If you have won, you have won. If you have lost, you have lost.
But that's the point he's making, that you cannot also tell them the path to arrive at their destination.
How can they tell the supporters that they have won and go to court and say that they have not won, but they want a rerun?
Which part of our arguments
you tell supporters that you have won the elections?
I want him to finish.
Wait a minute. You tell supporters that you won the elections.
I want him to flow.
You won the elections. That's why I said I will not mention any of the names of the NDC officers who even made those statements, including President Mama who said that he will not accept the result of a fraud election.
2012. I'll give you that video.
Without too much time.
And that's, as far as he's concerned, he has won the election. Ghanaians have given him the mandate. Now the question I ask myself, why then do you go to court and say that you want a rerun? And in fact, even if a rerun, you don't even tell the court the numbers you obtained that you want the court to grant the relief of a rerun. You see, let us make this point very clear. Granted, without admitting it, the EC itself had made it very clear that, well, there was an error on, instead of saying total valid votes, it said total vote cast.
Yes.
Question I ask myself, how did this materially affect the results that Ghanaians are going to queue and voted for a particular candidate to be the winner of the elections? How did this pronouncement, the declaration, affect the people's mandates? You and I are going to queue. And it's a cumulative numbers of how many people queued that is said you have won, you have lost.
Same argument in 2012.
Wait a minute.
Same argument.
Wait a minute.
That's what is interesting about this.
I want to wrap so I do a commercial break before I come to
vote. The numbers are such that His Excellency Nana Akufo-Addo obtained the highest number.
It sounds almost like
plus one. Okay? You are saying that the pronouncement made by Mrs. James by not saying total valid vote, but total vote cast. Okay? And the number that was used. So in your view, you are in court. Even though subsequently corrected to reflect the actual figures, you are in court.
But
so how does that one materially affect the actual numbers?
No, but can we not ask that if the emphasis on the declaration by the only person so constitutionally mandated,
and that is what makes it valid.
So,
that is what actually made it valid.
Comes with a certain level of preparation.
You see,
let me
okay, Comfort. Okay, for
comes with a certain level of preparation.
You see, if this man does not take well, by the time we leave here, he knows what I can do to him.
This is unfair.
This man does not take care.
We all know.
Yes, by the time we leave here, you know what I can do to him. You must check yourself. Please proceed.
You know, is it not reasonable to raise questions of an error on such an important constitutional duty that comes with such preparation and can only be performed by one person, as clearly stated? Because if the person declares Gary as president on that day and the numbers don't match it, does the person organize another press conference to say, okay, oh, I made a mistake, it is rather Nipa who should have been president and not Gary? Looking at the movement and what it comes with, should we downplay a wrongful declaration?
You see, if you follow the court proceedings yesterday, you have that on your mind at all, that prior to the announcement or declaration being made, the EC chair was very clear in her mind, as a sole returning officer, that NDC and President John Mahama had lost the presidential elections. And it's for that reason that their agents at the National Coalition Center left the place. So she had no doubt at all as to what she was going to do from the evidence so far that we have seen in court, played out in court. Now, the question that you ask, granted without admitting that declaration was even an absurd declaration, whatever you might even call it. I have not gone for any presidential elections. So how will my name even come in as a person who will have won the election, or this man will have won the elections? You see, the EC chair and the returning had come out and he said, look, based on these figures that I have received and so far collated, regional coalition centers, national coalition centers, it is essentially President Akufo-Addo who has won the elections. And for them to even sit in their own comfort zone, in their internal coalition, and say, oh, based on their internal coalition, President Mahama had won the elections, they should be confident enough to carry that internal coalition of the results to court, to inform the court that based on our internal coalition, we won the elections. I don't go to court and say that, oh, nobody can choose the route for you, and therefore you are in court to say that you want a rerun. One, as a matter of fact, you have told your supporters and sympathizers of NDC who are also going to kill to vote for you. And they have made them believe. You see, that is my difficulty. You made them believe that he won the elections. And they were on the streets all over the country, burning tires all over the country. And even members of parliament of your side also indeed believed that indeed the election was won by President Mahama. They believed.
And that is what you struggle to reconcile.
And that is why I'm saying that having made everybody to believe that you won the elections, you cannot go to court with a different story.
No
That
problem.
you didn't win the elections, but you want a rerun of the elections.
Let me take a quick break. When I come back,
second elections.
and then Franklin will end the conversation for us. We'll be right back. Welcome back to the big issue. And Nipapo,
yes, so
you have final rebuttal.
Yes, let me quickly address some of the issues that my brother raised.
Yes.
First and foremost, it must be made clear that the case in court by the NDC is based on the fact that you don't just get that to become president. You understand? Somebody has to make a declaration which, in the face of it, the law says prima facie constitutes the fact that you have been elected president unless challenged and overturned by the Supreme Court. That procedure, okay, if there is an infraction of that procedure, it is for the court to tell us, because this will be the first time that anyone is taking to court the issue about the process of declaration. So this is going to guide all of us that if, and remember, that's how dangerous it is, because imagine that an electoral commission head has all the figures from the country in front of it, but he says that based on the fact that, and the law is clear, nobody else can declare the presidential candidacy as president. So an electoral commissioner who wants to be mischievous decides that even in the face of whatever evidence available, I make this declaration. If you don't like it, go to court. Do you understand me? There must be rules and regulations guiding the process. So let us subject let's not subject Madame Jimensa to that strict test, whether she met the constitutional requirements in the process of declaration. If she did not, okay, if she did not, what are the consequential orders that the court can make?
Okay.
The court can decide, for example, that
don't give the court examples.
But no, what I'm just saying is that
don't give the court examples.
No, but see, the point is, if she made mistakes in respect of the declaration, and she's the only person who could have declared. So if that declaration was a mistake, and the foundation being a nullity in terms of the fact that the percentages that were put out as to the person having, because one of the arguments of the NDC, which they keep trying not to make or let anybody understand, is that per the figures that she mentioned, our mathematical position, which has not been challenged, per the figures that she announced 3 or 4 different times, is that no candidate obtained 50+1 based upon the figures that she mentioned, both at the press conference, on the website, and other.
So their mathematics was wrong, is the point, yes?
The point is, and that is the point. The point being that the person who made the declaration has a constitutional duty to ensure that whoever
her math is right.
It's 50+1.
Simple.
So it's simple.
No
so she will be given the calculator. You see, the way that
Mr. Seduketa was tapping at his Casio yesterday.
She will be given the evidence of her declarations. She will be given the evidence of her declarations. She will be given the calculator. And I'm happy that she didn't send anybody to come and do this particular way, but she herself has sworn the witness statement.
No problem.
So as for me, I'm just waiting for Ghanaians to see Mr. Chachuchikata and the head of the electoral commission, the issue about what the constitutional requirement is in respect of what percentage the person must get to be declared president, what percentage she declared, and whether anyone per those provisions or per those declarations obtained 50+1.
Gary, 30 seconds.
You say, now, Mr. Boafo, let my brother understand that declarations are not made in vacuum. They are not made in vacuum. You don't just sit there and make declaration. They are made based or pursuant to results collated.
Good.
Results declared at the various police centers, regional collation put together, national collation put together, and then it is declared. You don't just make declaration in vacuum. That is the point that you and you see, they are not in court challenging how the election was conducted, how the numbers were put together at the various polling centers, how the numbers were put together at the various polling centers. They are not challenging all those things. Whether people who are not supposed to have voted have actually voted, they are not challenging all those things. They are not challenging any of those things. How their agents have signed the pin sheets, they are not challenging any of those things. And they are just in court saying that, oh, somebody has said something about declaration. But you know, our agents have signed. But court, listen to us. Let's see how it goes.
Yes.
Okay.
Let's see how
Let's see how it goes. Let's see what our listeners are also saying.
The EC commissioner in court.
Yes, messages. The NDC, I know, is the real architect of every single inconvenience we have always had in the history of Ghana's politics. The one called General Mosquito kept telling the world before and after the election, which led to the burning of car tires and lots of uncharacteristic behavior. Yesterday, he told the world again that the position is not to challenge the validity of the election. With the help of calculator, he could not come out with a different figure. This is coming from Abdul Rahim, Oga from Garu. And also coming through PK and Lambele says in 2012 after the election, the late Sir John told Ghanaians and MPP supporters that the party had won the election, so they should all wear white and go to church. Was the MPP not misleading Ghanaians in 2012 with this comment by the late Sir John as General Secretary in 2012? And since I wonder if the truth always comes out in our courts. We all saw what happened before, during and after the elections. Most of them violated CI 127. If it is based on what I have seen, the current president wouldn't even have gotten 30%. This is Kuku from La Paz. Okay. Farah from Tama says the continued delay antics of the petitioner and the witness and his lawyers is unbelievable. So what is Mr. Sidun Ketia doing in the dock if he's not able to answer simple petition-related questions? The deception must stop. Nipaku, somebody says you should call him, so I'll tell you about that later. Xylix Dwayne from London says, I'm happy about this election petition. Ghanaians will learn a lot, and I can't wait for lawyer Chikata to cross-examine the chairperson. All we want is justice and peace. Gary, give us a break. The MPP did worse things in 2016. This is Kweku again from La Paz. Okay, unfortunately, I've run out of time, so Franklin, do forgive me on this matter. I have exhausted the time available to me. Well, okay, I'm trying to have a couple of minutes. So, Franklin. There you are. Franklin, wrap up for me.
Listen, I'm enjoying the conversation in the studio, and my good friends are doing justice to each side of the position. At the risk of sounding like a broken record, I mean, I've been on record. As you know, we've been on record from day one that the EC was in danger of discrediting an election because of the things they've done. I didn't know that they will eventually disenfranchise my own people, South, including 30,000 strong voters. And so for me, everything happening is just a realization that the EC could have done a lot better, and that on this election petition that is before the court would only expose one thing, the untruthfulness of the EC, and then the rushed and unfortunately the bad judgment that it supervised. I don't know whether it was going to turn into a case that the election should be rerun or what have you. I think that the conduct of the EC led to the single most important issue in the country right now, the disenfranchisement of 30,000 voters. We don't have a representation in parliament. That for me is really more important than the election petition going on right now. But it was as a result of the conduct and the behavior of the EC. So for me, I'm only waiting to hear and see the EC actually confirm that it wasn't particularly, helpful in the way it conducted itself before the election and during the election. I wish them well, really.
All right, then. Thank you very much, Franklin Kujo. And a big thank you as well, Nipa Kusa Mwado and lawyer Gary Nimaku. We will be following the election petition. And yes, it is always live on 97.3 CTFM and also on City TV. I hope you enjoyed this episode of The Big Issue. My name is Godfred Akoto Boafo. Have a good weekend.